What can we learn together by international linking and collaboration? Dame Cicely Saunders had a global vision, that palliative care should become part of mainstream healthcare and that its principles and skills should be adapted to local settings and cultures. Hospice and palliative care has now developed in 136 countries, but only 66 of these have some form of children's palliative care. There is still so much to do to make sure everyone with a life-limiting illness has access to medical, psychological, spiritual and social support.
We have in this world, we have the knowledge, we have the skills, we have the drugs, we have multi-professional teams.
It is up to us to reach out to others across the world and share our knowledge and make a difference to the lives of children and their families. Across the world, it is thought that there are 20 million children who could benefit from palliative care. Unfortunately, despite palliative care being an essential human right, only a very small minority of these children will have access to the care they need. Unlike children in the UK, many children around the world have no alternative but to suffer unnecessary pain and isolation. This is because there is a lack of understanding of what children's palliative care is and who it is for. Very few health workers are trained in working with children. Crucially, across the world, there is fear and taboo in acknowledging illness and death in children, both by families and also by health professionals. It doesn't matter where they are in the world, all children have the same palliative care needs. Even when resources are limited, good quality hospice and palliative care for children can be provided. It may look different, but the end result is the same, improving quality of life and relieving suffering. Ultimately, we are all working to let children be children as much as possible. We need to do more. We have a responsibility to come together and share our knowledge. Hospice and palliative care staff and volunteers across the world are using the resources available to them to deliver good quality hospice and palliative care, often in very innovative ways. For instance, in some countries in Africa, nurses can prescribe morphine. In India, local women who work as health educators and activists in rural communities have been trained in palliative care to educate and support local families. They also actively create community awareness and demand for palliative care services. Children with life-limiting illnesses in India and Malawi have formed empowerment groups and are directly influencing the design of the services they receive. We can all learn from each other through linking and collaboration. By reaching out and understanding, we might challenge our own assumptions, feel re-energized and motivated, and view challenges and opportunities with a fresh pair of eyes. There is so much to share, and so many ways to reach out today. If you're just starting out, you might start by researching a country or service that interests you, developing a personal link with someone overseas, potentially initiating an online exchange between staff. If you already have some international linking under your belt, you may consider inviting international visitors to be a guest speaker at a staff meeting, offering a clinical placement to someone from another hospice or team, or holding a World Hospice and Palliative Care Day event to support international palliative care. And if you're already some way down the road towards international cooperation, you might consider volunteering overseas, develop a partnership with another team or hospice service, or working on a joint academic project. Take a step today, reach out and discover more. To find out more about international children's palliative care and how to get involved, email Sue at info@icpcn.org. You can find out more useful information at icpcn.org, togetherforshortlives.org.uk, hospiceuk.org, ehospice.org, the WHPCA.org and worldday.org.